I think the best thing as I would watch the dentists restore these. So I've got in the first one and the second one, I did go and see a number of them be restored. And when you take out a custom healing abutment, which basically has the same, subgingival contours as like an anterior provisional, it looks very, very similar, in
Mhm.
cross section. And when these things would come off, you've got your tissues cultivated, and when you put a scan body on, you can scan deep, deep inside, into that new sulcus. So it was, you've recreated the emergence completely. And I think the biggest thing for me was, as I've learned spending time with a lab technician friend of mine, a lot of time with a lab technician friend of mine was watching and understanding the gap in knowledge between the lab technicians, what they're getting from the lab from an emergence profile point of view from the dentist, and how to that along. I think that's obviously they want to have something cosmetic there, but ultimately what's better for the patient is that we've created an ideal emergence from day one that the lab can replicate, the dentist can easily replicate, and then we give a patient like an ideal restoration long term. So I think that it's a win-win for everyone, and especially the lab, usually when they get implants from, a lot of times nowadays, a lot of it's obviously done digitally, but it isn't really a lot of sophistication that goes into creating an ideal emergence. It helps communication and, like I said, I mean, everybody involved.